Welcome to Phase 4 of your Total Knee Replacement Rehabilitation Program. This phase represents the final stage in your recovery journey, where we focus on advanced exercises designed to maximize strength, balance, and functional independence. By completing this phase, you'll be on the path to achieving the mobility and stability needed for daily activities you enjoyed. Phase 4 is the final stage of your knee replacement rehabilitation, typically spanning weeks 6 to 10. This phase builds on the progress you've made in the earlier stages, with a focus on maximizing knee function and independence. Key goals for Phase 4 include achieving 120 degrees of knee flexion, full extension at 0 degrees, and the ability to navigate stairs independently. Additionally, we aim to normalize your walking gait and increase your walking distance with minimal support. These objectives will help you transition back to daily activities confidently and comfortably. In Phase 4, our focus is on achieving full functional independence with optimal knee range and strength. Key targets include reaching 120 degrees of knee flexion and 0 degrees of extension. Along with enhancing range of motion, we're also working on building strength and balance to support activities of daily living. This phase emphasizes functional tasks like stair navigation, where the goal is to manage stairs without assistive devices and walk longer distances with a normalized gait pattern. These goals set the foundation for a confident return to everyday activities and long-term knee health. In Phase 4, the exercises are more advanced to prepare you for independent movement. This phase includes exercises like the leg elevated heel slide, stair lunge advanced, knee isometric, bridges, squatting, forward step up, forward step down, balance exercises, and bag hangs. Each exercise is designed to reinforce your knee's strength and stability for functional movements. As always, perform these exercises with good form to maximize your progress. In Phase 4, we continue with the elevated heel slide to further improve knee flexion and control. For the leg elevated heel slide, use a towel or strap for assistance. Slide your heel towards your body, hold for 10 seconds, then extend your leg. Perform this for 2 minutes, 3 times per day. This movement helps enhance your knee's flexibility and prepares it for more advanced functional activities. In Phase 4, the stair lunge helps build strength and flexibility. Step onto a medium height step with your affected leg, shifting your weight forward and bending your knee. Keep your back leg straight and use minimal hand support. Pause briefly, then extend your knee to return to starting position. Progress to 3 sets of 15 reps, 1 to 2 times a day. Once 3 sets of 10 reps becomes easy. As you get stronger, progress by increasing the step height, reducing support, holding the position longer, or adding weights. In Phase 4, progress the knee extension isometric by adding resistance to further strengthen the quadriceps. Sit in a chair with your knee bent at 90 degrees, place a resistance band, physio ball, or even press your foot against a wall for added resistance. Push your foot forward, engaging your quad muscle, and hold for 20 to 40 seconds. If you're ready to increase difficulty, try holding for a longer period or using a stronger resistance band. Perform 5 reps, focusing on maintaining muscle engagement throughout. In Phase 4, the bridge exercise helps build strength in the glutes, hamstrings, and lower back. Lie on your back with your knees bent and feet flat on the floor. Lift your hips by squeezing your glutes, hold for 3 to 5 seconds, and then slowly lower down. Perform 3 sets of 10 repetitions, 2 to 3 times a day. As you advance, you can add weight to your hips or try single leg bridges for an additional challenge. In Phase 4, progress the sit to stand exercise by moving to a squat without fully sitting down. Begin by squatting down to the height of a standard chair, lowering yourself as close as possible without actually touching the seat. Focus on controlled movements, then push through your heels to return to standing. As you get stronger, progress to squatting down to a lower surface, such as a stool or box, which increases the range of motion and difficulty. Perform 3 sets of 10 reps, 2 to 3 times per day. For added challenge, hold dumbbells or wear a weighted vest once you can complete all reps with good form. In Phase 4, the forward step up helps strengthen the knee and improve balance. Start by stepping up onto a medium height step with your affected leg, pushing through your heel to lift yourself up. Keep your knee aligned directly over your foot to avoid strain. Perform 3 sets of 10 repetitions, 2 to 3 times per day. To make it more challenging, increase the height of the step or hold light weights in each hand. This exercise builds strength for climbing stairs and functional movements. In Phase 4, the forward step down improves knee control and stability. Begin standing on a step with your affected leg, then slowly step down with the opposite leg, controlling the descent. Keep your knee steady and avoid any sudden drops. Use hand support if needed for balance. Perform 3 sets of 10 repetitions, 2 to 3 times per day. For added challenge, try using a higher step. This exercise prepares your knee for controlled movements, like descending stairs. In Phase 4, single leg balance is progressed to improve stability. Stand on one leg on a pillow to challenge your balance. Keep your hips level and your core engaged. Hold this position for 20 to 30 seconds, then switch legs. Do 3 sets on each leg, 2 to 3 times a day. To increase difficulty, reduce hand support or hold light weights in each hand. This exercise helps build balance and strength for everyday movements. Phases 4. Continue with bag hangs as done in earlier phases to improve knee extension. Sit with your legs supported on 2 chairs and place a weighted bag, 1 to 10 pounds, over your knee. Let gravity gently straighten your knee, holding for 3 to 5 minutes. Repeat 3 to 5 times per day. Now that we're in Phase 4, we're focusing on exercises that promote final recovery and functional strength. These exercises are designed to enhance your range of motion, strength, and balance, enabling you to confidently return to everyday activities. For this phase, you'll complete exercises like leg elevated heel slides, knee driver, knee isometrics, bridges, squatting, forward step-ups, forward step-downs, balance, and bag hangs. Each exercise is geared toward reaching full knee extension and flexion, helping you maintain stability and strength. Be sure to follow the recommended repetitions and frequency for best results. This concludes the Phase 4 portion of our Total Knee Replacement Rehabilitation Program. If you have any questions, please don't hesitate to reach out. Your full rehab protocol is available, which includes contact information and guidance on progressing through each phase. Remember, following this structured program with your therapist's guidance will help you regain strength, function, and confidence in your movement.